I am Sierra Fisher, and this is my second informative speech. According to Deborah Lee and Rosalind Carson DeWitt, vaccines are widely used and very effective in preventing diseases. Quote, for more than 200 years, since Edward Jenner first experimented with a vaccine for smallpox, this medical technique has protected millions of children from deadly diseases, end quote. I'm going to discuss schools' requirements of vaccines, how getting immunizations make children healthier, and benefits of vaccines. Schools require vaccines because they are proven to be effective and prevent diseases. According to Erica Hayden, Amy Joseph, and Robert Field, the Task Force on Community Preventive Service found that having vaccine requirements for children and college kids to be effective. If an individual does not get immunized and comes into contact with people who are, they could increase harm, spread disease, and possibly leading to death. With these risks, schools started to make immunizations a requirement. To prove immunization records, they have to get them from a physician or public health officials. Meeting state requirements are very important, especially in keeping records up to date and to verify them. Recommended by the Advisory Committee on Immunizations, children should start as early as birth, receiving approximately 11 vaccines for 15 vaccine-preventable diseases. Federal law privacy rules that are considered when considering vaccines are the Family Educational Rights and Privacy Act and the Health Insurance Portability and Accountability Act. The Family Educational Rights and Privacy Act protects children's educational records, and the Health Insurance Portability and Accountability Act governs the privacy of health records. To keep all the records, requirements, and recommendations, a improved system was needed as an immunization information system was created. 79% of schools or child care facilities have to report immunizations with the allowance of local education or public health departments to access them. Quote by Erica, Amy, and Robert. The types of violations include 1. Not providing proof of immunizations. 2. Disclosing records without the appropriate notification or consent. And 3. Otherwise not following the provisions of the law. Students can be dismissed from school if the schools are not receiving medical records after being informed. Children are healthier getting immunizations routinely because they can prevent 14 different diseases like hepatitis A and B, HIV, influenza, measles, mumps, polio, and so on. Reported by the Department of Health and Human Services, Center of Disease Control and Prevention. The job of the immune system is to protect us from outside things entering our body that doesn't belong. For example, germs, like bacteria and diseases. The body notices the germs that don't belong as non-self, and antibodies rid the body of them. Our immune system is unique in the way that it remembers the exact germ that enters our body. This way, if that same germ comes back, the body will be able to fight it off and destroy it quickly. But in order for a child to become immune, they must get sick first. To solve the problem, the vaccine contains the same germ that caused the disease, but the germs are already dead or weakened to the point that you won't get sick from them. When receiving a vaccine, the vaccine stimulates the immune system to protect antibodies just like it would if you were exposed to a disease. In other words, developing immunity without having to get sick first. Bernhusen, Carfiero, and O'Brien concluded that benefits of vaccines are healthier people who tend to be physically stronger, children and young adults, that are healthy are more likely to attend and progress through school. In areas of low mortality, families have less kids and engage in more of each child's education. By avoiding vaccine preventable diseases, children survival has increased. The Department of Health and Human Service, Center of Disease Control and Prevention, noted that personal benefits in having vaccines is that it will protect your child from serious diseases. The chance of your child getting sick from a preventable disease is extremely low, and when you choose to vaccinate your child, you are still taking a tiny risk. If you decide not to have your child vaccinated, you are betting that they won't be exposed to a disease and won't get sick. Community benefits is if the community of kids are immune, then if one gets sick, the disease probably won't spread. But if fewer kids are immune, they will become more acceptable for a disease to spread from person to person, causing an outbreak. Stated by the Healthy Children magazine, Back to School 2012, most childhood vaccines are 90 to 99% effective in preventing disease. And if a vaccinated child does get a disease, the symptoms are usually less serious than if a child who hasn't received a vaccine. Children vaccinations are very important. There are many diseases and sicknesses. A vaccine is one way to rid or eliminate these sicknesses. We have just discussed schools' requirements of vaccines, how getting immunizations make children healthier, and the benefits of vaccines.